Welcoming everybody to the webinar series. This is the third series Anadash Group is doing with People to People USA, and it's really exciting. It's talking around leveraging AI in tertiary education, specifically in emerging markets in Africa and others. And I think this is the third round where we're really focusing on impact of AI to improve efficiency in delivery of healthcare. The previous ones spoke specifically on clinical care and AI in general, but we have a series amazing speakers and moderators and panels. And just to respect everybody's time, I just want to go ahead with the agenda. And Dr. Nauga Mahari, please, from People to People, if you can do the welcome remarks, and we'll go through the agenda as we speak. Thank you.
Thank you. Good morning, good afternoon, everyone, wherever you may be. And on behalf of People to People and Anadash, I warmly welcome you to today's session, Artificial Intelligence, Leveraging AI to Improve Efficiency in the Delivery of Healthcare. Across the globe, and especially in Africa, healthcare systems face workforce shortage, rising patient demands, and persistent efficiency gaps. Artificial intelligence is no longer a futuristic concept. It is increasingly becoming a practical tool to help us work smarter, improving workflows, strengthening training, supporting decision-making, and expanding access while keeping people and patients at the center. It is also important to be clear about what AI is and what it is not. We humans use our brain to think, reason, exercise judgment, and apply ethics shaped by lived experience. AI does not have a brain and will never replace a human brain. It works through algorithm and data, identifying patterns and generating insights. Used wisely, AI should augment clinicians, educators, and health leaders, not replacing them. Our goal today is simple: to provide practical insights, share real examples, and identify clear next steps for responsible and scalable use of AI in healthcare and capacity building. We are honored to begin this program with opening remarks from Dr. Bekalu Wubishat Zode, Chief Executive Director and Vice President of the College of Medicine and Health Sciences at the Baba John Specialized Teaching Hospital, Bahir Dar University. Dr. Bekalu is an Assistant Professor of Orthopedic Surgery and a Consultant Pediatric Orthopedic Surgeon certified by the College of Surgeons of East, Central, and South Africa. He is a respected clinician, institutional leader, and a skilled communicator whose dedication to strengthening medical education and advancing clinical excellence continues to shape Ethiopia's health landscape. His leadership at Baba John Specialized Teaching Hospital reflects a deep commitment to system building, collaboration, and innovation in service delivery. Dr. Bekalu, we are truly honored to have you with us. Before I extend the floor to you, following these remarks, our session will be also moderated by Dr. Brano Alamayo, Assistant Professor of Professional Practice at Rutgers Business School. Dr. Alamayo is a distinguished health economist, applied statistician, and educator with more than 20 years of experience in health economics, outcomes research, and advanced analytics. He earned his doctorate in health economics and human policy from the University of Michigan and holds a master's degree in mathematical statistics from the University of Texas. In addition to his academic career, he has held senior leadership roles at Merck, AstraZeneca, Novo Nordisk, and Medico Health Solutions, where he led teams conducting clinical trials and real-world data analysis across multiple therapeutic areas. His research has had national impact, including work cited in the 2012 U.S. Supreme Court Affordable Care Act decision. He brings a rare combination of rigorous analytical expertise and practical industry leadership to discussions on health care policy system performance and data-driven innovation. Dr. Alemayo, we look forward to your leadership in guiding today's discussion, and thank you all for being part of this important conversation, and thank you.
Thank you, Dr. Naogho. I appreciate very much. I just wanted to, also tell you there's introductory remarks, which I will introduce later on after Dr. Bakalu, Ms. Vanshi Lingapali, as well as the pleasure of moderation from Dr. Kechi Achebe, Director of Global Public Health and Development Executive, who will be moderating panel 2. When it comes to each of their time, I will be able to introduce their profile. So without much ado, though, I would really appreciate and warmly welcome Dr. Bakalu Wibshet Zode to give the opening remarks, please. Thank you.
Okay. Thank you very much. Thank you, everyone, especially for giving me this chance for people to people and Team Anadak. Distinguished guests, colleagues from Anadak and people to people networks, fellow health leaders, health professionals, and the academic community in Africa and beyond. Welcome to this series of webinar, especially to the third round on leveraging AI, specifically to increase the efficiency of healthcare delivery, specifically in low-income countries and in Africa. It's an honor for me to welcome you all to this timely discussion. As previously mentioned by Prof. Naogho, I'm joining you from Bahir Dar University. Bahir Dar is the capital city of the Amhara region in northwest Ethiopia, about 45 minutes flight from Addis Ababa, the capital, and it's known to be a Blue Nile city and also a Palm City, which is also recognized as a UNESCO Learning City since 2015. So this is where Bahir Dar and our teaching hospital, Toba Begion Specialist Hospital, and the School of Medicine is located, to give you some information. So as you know, we are currently living through a pivotal movement in history. The question is no longer if artificial intelligence will change our healthcare system, but how fast we can lead this transformational technology change to ensure and serve our people equitably. This technology transformation is just available for everyone in the globe. It depends on how fast we adapt. We, position ourselves to use the maximum out of it, specifically in the healthcare arena, especially in tertiary settings like ours, our teaching hospital, higher education, tertiary education, and universities. Having a conversation about the artificial intelligence and how it will impact our patients, our health science education, medical education is very much instrumental and timely. You can imagine, how an AI-driven triage system can prioritize high-risk maternal cares in a rural area in any part of the world, specifically in Africa, and how a machine learning algorithm can assist, our radiologists or our cardiologists or our diagnostic health professionals to, specifically and precisely diagnose a disease entity and reach into a management the earliest possible, especially, in a remote area where these health professionals are scarce. This artificial intelligence diagnostic capability will have a significant contribution to the system and to the cost effectiveness of the healthcare. We are not really, I don't think we are really looking for, an AI to replace a clinician, but we are looking for an AI to handle the data heavy lifting, so that our doctors, nurses, health professionals can return to the heart of medicine empathetically and with the bedside patient care really done overwhelmed with an overwhelmed, scientific evidences, ever-changing evidence and the like. So really the human element, the clinician element will be persisted, but the AI will really help in this big data, scientific evidences, ever-changing ones, to sort out and give, an information and a guidance to our clinicians. From a teaching point of view, generally, we cannot really prepare, the upcoming doctors, health professionals for 2013 with a teaching method of 20th century or 19th century. So it has significantly shifted the curricula, the integration and the digitization has significantly evolved. So we have to keep, our teaching hospital medical schools should be up to date with this perspective too. So it doesn't work, the one size fits all curriculum will not really work in the 21st century, especially when AI is, coming into picture. So the medical schools, the College of Health Sciences, universities in medical education, health science education, should keep themselves to the standard and to use the maximum what the technology will give us. So we used to know we have, see one, do one, teach one algorithm and teaching method for a while. But if we add this with a simulation experience, our students can simulate 1,000 times using the AI-powered virtual reality and high-fidelity simulation. So this will also significantly change the teaching learning methodology and the teaching learning experience without making patients in danger from the process. So our students, including our faculties, need to have a reasonable AI literacy because we cannot, escape this technological transformation. So as leaders, as professionals and physicians, we have to think also about AI literacy to our faculties and the students so that they can navigate through the world and they will be really competitive to the global graduates. And if they want to practice anywhere in the world, our graduates should be to the same level from AI literacy point of view. So besides, having or buying a software or using AI for one or another thing, we have to think also innovating, an African well-designed and well-adopted kind of softwares and applications so that can fit into an African population. So the innovation part does have also a significant role in this regard. So I really look forward in our university, in Barda University, we are almost adapting an AI policy at university level. And we are looking forward to start influence of AI in healthcare to have an efficient health system in our teaching hospital. So this webinar will be a timely one from our institution point of view. So the leadership, AI will not bring all the benefits. It's not going to be a perfect thing. So the governance and the leadership is expected to have some regulation and some data security, and all those things will come into the fellow health leaders in Ethiopia, in Africa, and beyond. In closing, let's remember that while the technology is artificial, the impact on our patients is very real. And at Trabegion, our motto is dedicated to excellence and committed to care. Today, we add a new chapter to that excellence and care. We have to innovate for our community to use the maximum of these technologies. So all the virtual attendees, thank you for joining. Thank you, Anadach, and people to people for building this bridge of knowledge. I look forward to the insightful sessions ahead. Thank you so much.
Thank you. Thank you so much, Dr. Bakalu. Indeed, very insightful on how we need to look at AI in terms of new curriculum development and transforming delivery, right? Thank you. Anybody who has comments, please feel free to put it in chat, questions for anybody. We'll move ahead with introductory remarks from Ms. Vamshi.